Now, I'd like to introduce our presenter for today, Janel Davis, Communications Officer for the Silver State Health Insurance Exchange.
Good morning, everybody. Thank you so much for having me. I'm going to talk to you about who we are and what we do and Nevada HealthLink, and we're well underway in open enrollment. So this is kind of an extensive PowerPoint presentation, so Danica, I appreciate you being humble and letting me put video in it. So I'll try and get through it as quick as I can, and like Danica said, answer any questions you may have. My name is Janel Davis. I am the Communications Officer of the Silver State Health Insurance Exchange. We operate the online marketplace, which is known as Nevada HealthLink. So we're often referred to as the exchange, the marketplace. It's kind of confusing for consumers especially, but we have 7 executive board members and 13 staff. So you see us all there on that picture. We're actually the smallest exchange in all of the state-based marketplaces. We have 2 people in Henderson, and then the rest of our staff is in Carson City. So the next slide, this is what it feels like we do. And it wasn't mean. It's actually supposed to be SpongeBob blowing out fires, because that's what it feels like we do on a daily basis, especially given the nature of events and the focus surrounding healthcare policy with the administrations over the last several months. So thankfully, we work with a great team to reduce the uninsured rates statewide. So what we really do is facilitate and connect Nevada residents who are currently not insured through their employer or Medicaid or Medicare to qualified health insurance plans. So individuals can purchase ACA-certified QHPs through the exchange, and if they're eligible, they can receive subsidy assistance to help offset their monthly premiums and out-of-pocket costs. Nevada is a little bit unique. We are a state-based marketplace that uses the federal platform, so we're sort of like a hybrid model. And that means that we strictly use healthcare.gov for eligibility and enrollment purposes only. So technically they're our technology vendor. We are a solely self-funded state agency, and we use no general funds. And as a state agency, our statutory requirements are as follows. We administer, oversee all of our advertising, marketing, and outreach and consumer education. And as the communications officer, that's kind of what I oversee. I oversee the marketing and outreach budget for Nevada HealthLink. And then our other employees do plan management and coordination with state insurance departments. We work very closely with the state agency Nevada Division of Insurance. We operate a statewide consumer assistance call center that we actually share the wall with us here in Carson City. So people answer the phone for us instead of, an automated system. We fund and oversee the Navigator program, facilitate the sale and purchase of plans through partnerships with certified enrollment assisters, navigators, in-person assisters, and the broker community. Annual financial management and performance audits, revenue collection and reconciliation. We have had a lot of audits over the years, typical just state agency protocol. And then, of course, general administration and management of the marketplace, the federal hub, and continuing to build on stakeholder relationships. And so here's our mission statement. I quickly wanted to just show the video. We recently focused on infiltrating some consumer testimonials into our marketing and advertising campaign. And so I hope you've seen them around, but we were able to find 2 Las Vegas residents, and they were able to tell their stories and their experiences with obtaining health insurance on the exchange. And so I'm not sure, Danica, if you can play that video or if we had time to watch that.
I don't know if there was a video connected to the slide that I saw, but there is another video later in the presentation.
Okay. Okay, yeah, we can do that one. This one was just a quick testimonial, but this story, if you have time, it's on our website, NevadaHealthLink.com. It's also on our social media channels and YouTube, and it's kind of a really inspiring story, and it makes us feel good about what we do in helping people find health insurance plans, because literally it can save their life. Okay, next slide. This just kind of gives you an overview of our carriers and the plans that are available on the exchange. So for plan year 2018, we will have 14 qualified health plans with 2 carrier options. So those 2 carrier options are Health Plan of Nevada and Silver Summit. We're offering 4 bronze, 7 silver, and 2 gold plans. All 17 counties in the state of Nevada are covered. The 14 counties, so counties Clark Knight, and Washoe will have the choice from all the 14 plans offered. And then those other 14 counties, which is mostly rural Nevada, will have the choice of the 4 plans only from Silver Summit. Along with that, we have 21 standalone dental plans. That's what SADP stands for, and those are the carriers offering those. You'll notice that the proposed rate increase before rates were released is 36.8%. And so even though that seems really high, because it is, premiums increase every year, we're seeing that over more than 85% of Nevadans enrolled on the exchange are actually eligible for federal financial assistance, which is known as subsidies, and those help offset your monthly premium costs. So when a premium goes up, so does that subsidy. So we're finding that Nevadans are seeing a very minimal, if no impact at all, to their premiums. We're also finding that there are many plans at an extremely low cost or zero cost for premiums. And so again, these are all income-based plans, and it depends, of course, on the individual's unique situation, but affordable plans do still exist. Next slide, please. So this map kind of gives you an overview of the regions that are broken up into the plan year 2018 carrier options on the exchange. Before open enrollment went underway, which started November 1st, we were seeing this map looked very, very different. I'm sure some of you saw that it was all red in those Silver Summit areas. So we were actually potentially going to see that 14 counties in the state of Nevada were going to be completely bare with no health insurance options. But with the work through the governor's office, the exchange, and the DOI, we were able to get Silver Summit to sign on to provide an option to those communities. All right, so moving on. The real deal, right? We've heard a lot of political rhetoric surrounding the repeal and replace of the ACA, but despite those federal uncertainties in D.C., the exchange is laser focused on this enrollment period. So we only have 2 weeks left, and we need your help getting the word out. So one of the biggest changes we saw was that it's a 45-day open enrollment period, and that's compared to a 90-day open enrollment period. So last year, we were enrolling folks all the way up until January 31st. So our open enrollment period was cut in half. So that was unfortunate change. It's flying by right now, but I think our message is being heard, so that's great. We really encourage active shopping for Nevada consumers of the marketplace. So really encourage getting that in-person assistance to help find a plan that's right for you, your budget, your health needs, and your family needs. With auto re-enrollment, we are carefully constructing what's called crosswalks. So, for example, Anthem and Prominence have left the state of Nevada. They've left the health insurance marketplace in the state. And so if there previously were consumers on an Anthem or Prominence plan, they will be crosswalked, what's known as crosswalked, to a similarly priced plan. But again, we still encourage to get that free local in-person assistance with an enrollment professional to make sure that you're re-enrolled into a plan that still fits your needs. So that bottom point there is important. We're estimating that 43,000 consumers who are eligible for subsidy assistance through the exchange are not currently accessing it. So our messaging is really focused on trying to find those individuals who are not enrolling in a plan, but they may not understand that they are eligible for this financial assistance, which again helps offset your monthly premium cost. So despite uncertainties, again, this was a video meme. I don't know if you've seen this girl on YouTube. She's pretty cute, but her eyes are rolling back and forth. Despite these uncertainties, open enrollment's going well. So the exchange is seeing a huge uptick in our website traffic, a huge increase in our customer assistance call center. We're encouraged that our messaging is working, and we're encouraged by these numbers that the message is being heard and Nevadans are educating themselves on their health insurance resources. You know, we're finding that people are getting enrolled in health insurance not just because they don't want to pay that tax penalty, but because health insurance is a safeguard for yourself and your family. So again, what's happening in D.C. and what does it mean for our state? So there are uncertainties surrounding cost-sharing reductions. The Trump administration decided not to continue to pay those cost-sharing reductions, but Nevada, luckily, because of the Division of Insurance and the exchange, how we built our plans in, Nevadans will not be affected by this because the cost-sharing reductions, if you were accessing a subsidy, you will still have access to that for plan year 2018. There's, of course, ambiguity, and it's not a popular thing around the enforcement of the individual mandate that we're seeing right now. There's a tax bill going on that the Senate still needs to vote on, and that is I think thought it was being voted on last night, but I guess there's a little bit of a snag. So, but within that tax bill, they put in there that they would repeal the enforcement of the individual mandate. So this is the tax penalty. If you don't have health insurance, there is a fee. It does still exist. And for this year, the IRS will be looking at tax returns, and if you don't have health insurance, that penalty still remains, and it is $695 per individual, or 2.5% of your yearly household income, whichever is higher. Okay, so this is the almost 2-minute video. We don't have to watch the whole thing, but this is kind of a compilation of our marketing and advertising campaign.
Hopefully it works.
Life is full of changes, from the well-planned to the unexpected. But no matter what, health insurance should always be a priority. And this year, our enrollment dates have changed. Don't miss your chance to get connected. The average back surgery will cost you $23,724 if you're uninsured. At that rate, you can't afford not to have health insurance.
Is the video coming through on your end?
It just stopped. That's okay. I appreciate the attempt. Hopefully you guys have seen our ads out and about. We're all throughout the state. We've done a traditional full media campaign. We are all over social, and everything should be running through all the way through December 15th when open enrollment ends. So if anyone has questions about that, I'd be happy to talk about it since I oversee that. It's a big part of my world. And, you know, obviously marketing and advertising is important to get our message out.
And the Chamber can also link the video to our website as well, so you guys can have that available to you.
Okay, thank you. That's great.
You are welcome.
All right, so this slide, so we're in our 5th open enrollment. That's the OE5, Open Enrollment 5. This is our ad campaign. And I kind of mentioned testimonials earlier, so those two gentlemen on the bottom are Michael and Edward, and they like I said, local Las Vegas residents who provided their stories and how they benefited from the qualified health plans they purchased through the Nevada Health Link. This continues to be an ongoing effort to learn more about real Nevadans and their experiences enrolling in a QHP. Like I said, our ad campaign is doing well. I feel like the message is being well received, and part of that message was to talk about what the cost would be associated with not having health insurance. So you can see those top two, you have a young guy bicycling, mountain biking, he falls down, has to go in and get shoulder surgery. This is the average cost. The one on the top right corner, a group of millennial hikers, he trips and falls and goes to the ER visit, and this is how much his cost would be without having health insurance. So we wanted to hit these audiences and show them, the cost comparison, because it's the number one question, right? How much is this going to cost me? Is it affordable? And can I include it into my budget? Go to the next slide.
Having just a little bit of a technical difficulty on my end. One second. Janel, it looks like my computer has frozen at the most inopportune moment, so
okay.
I'm not sure if you wanted to keep talking or my mouse is not moving around. I apologize
it's up
for
to you
that.
guys. There's only a couple slides left, so I'm happy to keep talking.
Yeah, feel free to keep on talking.
Okay. The next slide was just a snapshot of our revamped homepage design for NevadaHealthLink.com. Our website is obviously a very integrated part of the campaign and our call to action, but we didn't redesign the entire website. All we did was redesign the homepage, but it was a big endeavor, and the strategy behind that was to create a more consumer-facing landing page and homepage with easy navigation on topics such as learning about the ACA, Medicaid, how to enroll. We also include informational blog posts and then a media asset package for the media. So I think it's going well. We're seeing, like I said, a huge uptick in our increased website traffic. We're seeing like a 50% user increase with absolutely new users. So that's really exciting. It's hard work paid off, and I think it's a much better consumer-facing website. So visit NevadaHealthLink.com to learn more. Let's see. So the next page talks about federal cuts to outreach and marketing. So as I'm sure you are all aware, the Trump administration cut healthcare.gov's funding for outreach and marketing by 90%. So this doesn't directly impact the exchange, our grantees, our Navigator grantees, or brokers, our advertising marketing campaign, because we generate our own revenue to pay our Navigator and broker grants, our ads, marketing, outreach, and stakeholder development. It does, however, impact the exchange because while we have our own robust and comprehensive ad campaign, healthcare.gov, those TV advertisements that are no longer being seen or placed, they generated more awareness to open enrollment, and that it was critical to generate that awareness, especially for the younger and healthier population. Let's see, uncertainty about direct outreach to Nevada consumers. So previously, we received no member-level data at the exchange, so we rely on the feds to directly contact our consumers about open enrollment timelines, plan changes, et cetera. We recently were able to obtain some preliminary consumer-facing data. So now we kind of know who our consumers are, but previously we weren't able to directly market to them. So you can imagine how challenging that must be. We had to kind of do a blanket marketing instead of direct. Let's see. And then again, we had so many questions as to why our enrollment period was cut in half. So this is where we really needed help from our partners to ensure consumers complete their applications and effectuate and actually get through the enrollment process and know what they're doing, because it's a very confusing process, as you can imagine. Okay, so the next slide is healthcare.gov maintenance outages. So every year there's usually a maintenance day where they do outages, but this year they added a little bit extra time, which was slightly frustrating. There was an overnight outage on Wednesday, November 1st. So this means, anybody who's wanting to go to healthcare.gov, start their enrollment process, or have questions, they can't because the website is down for maintenance. Also, last year, our enrollment facilitators experienced really high wait times in waiting rooms online with consumers. So the enrollment process was taking not the typical 30 minutes to an hour, but much, much longer. So luckily this year, though, we're hearing from our community partners that there seem to be no outstanding issues with healthcare.gov with the website and enrollment. Another one of the outages are Sundays, 12 a.m. to 12 p.m., which is 9 p.m. to 9 a.m. our time. And so please mark your calendars with all of this, although we only have 2 weeks left of open enrollment. We encourage folks to get in-person assistance through our tool on NevadaHealthLink.com. This is located on Nevada HealthLink, and you can put in your zip code or a keyword and find a licensed enrollment professional near you. This is free in-person assistance, and we really encourage you to get that face-to-face interaction because, as I stated, insurance is very confusing, and you want to make sure you're getting the right plan, according to your budget and your health needs. So on December 15th, Nevada HealthLink will also be hosting an enrollment event and a holiday health fair. This will be in Reno and Las Vegas from 12 p.m. to 8 p.m., and this is an opportunity for Nevada consumers, that last-minute, last chance to enroll. We will have navigators and brokers on site available to help those individuals enroll. And then from 4 p.m. to 8 p.m., we will have a holiday health fair, to kind of incentivize people with the wait times. We'll have selfies with Santa, and we'll have all of our carrier vendors there to just kind of create more of a holiday atmosphere, since open enrollment falls right in the middle of the holidays. All right, and then the last slide, why are you important? The exchange knows from year-over-year growth in enrollment that we couldn't do it without the help of our partners. Nevadans have experienced a huge shift in the uninsured population from, pre-ACA to now, and that has offered substantial economic and public health benefits, so we can't go backwards. We need your help to let Nevadans know the facts. Like I said, open enrollment is shorter, November 1st to December 15th, so exactly 2 weeks from today at midnight is your last chance to enroll in a qualified health plan on the exchange. Like I said, consumers should actively shop the marketplace with a licensed enrollment professional, use our in-person assistance tool to locate a partner nearby. This is just an extremely important time given the, continued conversations surrounding healthcare policy and changes. And we just really want everybody to know that Nevada HealthLink is still here. We exist, and we're here to help you through the process. And then the last slide was just our contact information, so you guys can see that when you take the slides with you.
Janelle, thank you so much for bearing with us during this technical difficulty that's never happened on Chamber University before. But again, we can send out the slides to everyone who was on the call today. We'll make sure to put the ads that you guys were talking about on our social media channels as well. And Again, if you have any questions, feel free to press *7 on your phone to unmute your lines so you can ask your questions now. Or if you have questions after the fact and you think about them after the webinar has ended, you can always contact the Chamber and we can get you in touch with Janel afterwards. Janel, we have a lot of small businesses here. What would you implore them to do as far as navigating the exchange?
Yeah, so there's a lot of different ways to go through the enrollment process, but I would recommend to educate yourselves a little bit first and visit NevadaHealthLink.com. We have a couple tools on our website to see, what you actually qualify for. People may wonder, is this even an option for me? I don't know what's available. And so we have an estimate your costs price comparison tool on our website that's really helpful. You can put in your, again, these are all income-based plans, so you'll want to know what your estimated yearly household income will be for 2018. And then you'll, obviously, credentials, you'll need to be a Nevada resident and citizen and all of those things. I would start there, and then from there I would use that in-person assistance tool and call a licensed enrollment professional near you and make an appointment before open enrollment. Give them a call, set it up on your own time, and then have them help you walk through the enrollment process.
Wonderful. Thank you so much, Janel, and I want to thank you for joining us today for Chamber University. This recording will be up on, the audio will be up on our website soon. And again, thank you, Janel, for joining us today. Thank you to Nevada HealthLink and the Silver State Exchange. Again, if you have any questions, feel free to give the Chamber a call, and we'll make sure to get you in touch with Janel.
It was my pleasure. Thank you so much.
Thank you, everyone. Have a good day.